ZOLGENSMA, onasemnogene abeparvovec-xioi, is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
I found out that I was a carrier for SMA when I was 13 weeks pregnant. I had a carrier screening done at my doctor's office, and when we got the results, my husband Jeremy and I decided not to do further testing. When Stella was around 3 weeks old, I just knew something was wrong. So we did end up going to our pediatrician that day, and by chance, we saw the pediatrician who Stella saw at birth. When he started doing reflex tests, this pediatrician immediately saw that something was different in Stella. Something clicked in my brain and said, I'm a carrier for spinal muscular atrophy. And Jeremy's sister was a carrier of SMA, so we knew that there could be a chance that Jeremy was in fact a carrier as well.
The very first time we actually met Stella's neurologist, we had a conversation about treatment and treatment options pre-diagnosis.
Our neurologist had told us about 2 FDA-approved treatments, one she would have to receive numerous times.
And then the other option was a one-time dose that we were immediately drawn to because of the neurologist explaining the gene therapy.
When the genetic screening was done for Stella, our neurologist also tested Stella for the antibodies to see if she could or could not receive ZOLGENSMA.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
The diagnosis itself came on June 18th, that indeed Stella did have SMA type 1, and at the same time, we were also given the news that she was eligible and able to receive ZOLGENSMA.
So here we are getting this terrible diagnosis that no parent ever wants, but then we're being given so much hope that our daughter can get this treatment.
Talking to her doctor, we were talking about her being able to sit unassisted for hopefully a couple of seconds, maybe being able to scoot in place and get herself around, propel herself around a little bit. And at the same time, being able to tell us honestly that he didn't really know what to expect. I think that really kind of set and paved the path for us because we were able to be cautiously optimistic, but also realize that we really truly didn't know what to expect in the future.
Jeremy and I were able to talk with another family who had lost their son 9 years ago to SMA type 1. She said if we were given this opportunity, we would be in the car and we would be on our way down to the hospital. And from there, that's when we just knew we're doing the right thing for Stella. The next day, we went into our neurologist's office, and as soon as he walked through the door with his team, we told him that we wanted ZOLGENSMA.
Stella's SMA progressed from diagnosis to treatment in a way that it continued to rob her of her ability to move and breathe easy, and she had a fairly quiet cry.
You could barely hear her if she was next to you. She was that quiet. On treatment day itself, I don't think that I slept the night before. I was a ball of nerves. I didn't cry until we started infusion, and when I looked up, there were all the nurses that were standing at our door in tears. And for them to be able to be a part of Stella's treatment was so profound, and it'll always stick in my brain, remembering all of those nurses' faces as we started the infusion for Stella, knowing that this could be life-changing for her.
One of the very first things that we noticed after treatment with ZOLGENSMA was Stella was able to breathe easier, and not only did she breathe easier, but her cry got louder.
I have a video of Stella in bed where I'm encouraging her to cry. So to hear her scream and cry and be able to start moving, that's something we hadn't seen.
At 1.5, Stella is able to be fiercely independent and get around the house on her own with her wheelchair and explore and learn new things every day. Stella can sit unassisted for extended periods of time, which involves head control and trunk control. Stella is able to reach for her toys.
Stella can make all the messes her little heart desires. And I'll never, ever, ever be ungrateful for those messes because they mean so much more as a mom who didn't know if I'd ever see my child tear apart my Tupperware drawer.
SMA is still very prevalent in Stella's life. She isn't able to bear much of any weight on her legs. She requires assistance with her cough assist, her suction machine to clear secretions.
She also sees an occupational therapist once a week and goes to physical therapy twice a week. I hope that she continues to keep us on our toes. I hope I don't regret saying that. But I hope that Stella grows up knowing how special she truly is and that she continues to overcome anything put in front of her.
It is just crazy to see what she's able to do compared to the outlook that we were faced with originally.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into a vein. ZOLGENSMA was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about ZOLGENSMA? ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with ZOLGENSMA and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with ZOLGENSMA? Infections before or after ZOLGENSMA infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with ZOLGENSMA. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after ZOLGENSMA infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There's a theoretical risk of tumor development with gene therapies such as ZOLGENSMA. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after ZOLGENSMA infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and ZOLGENSMA? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to ZOLGENSMA administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of ZOLGENSMA may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with ZOLGENSMA. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of ZOLGENSMA? The most common side effects that occurred in patients treated with ZOLGENSMA were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.